welcome back to the Trauma Therapist Podcast. My name is Guy McPherson. My mission is to help trauma therapists be their incredible selves, to be human, to be real, not just a clinician. I'm a big believer in who we are is more important than what we know. And this requires cultivating authenticity, genuineness, and vulnerability, and that requires intention. You can learn more about my courses and workshops by going to thetraumatherapistproject.com. That's thetraumatherapistproject.com. Let's get started. All right, here we go. So 5, 4, 3, 2, and 1. All right, folks, welcome back to the podcast. Very excited to have as my guest today, Brooke Bralove. Brooke, welcome to the podcast.
Thank you so much. I'm excited to be here.
Appreciate that. So Brooke is a licensed clinical social worker, psychotherapist, advanced accelerated resolution therapy practitioner, as well as an AASECT certified sex therapist. She specializes in treating adults, couples, and groups with depression, anxiety, trauma, and relationship challenges. Through her facilitation of Brené Brown's Shame Resilience curriculum, she helps women let go of perfectionism and move toward greater authenticity, joy, and connection. Her new passion is accelerated resolution therapy, or ACE. ART. Is that right? ART?
You can say ART or ART, either one.
ART. Brief treatment modality using bilateral eye movements to provide lasting relief and healing to patients with PTSD, trauma, phobias, addiction, and depression. She holds degrees from the University of Pennsylvania and Columbia University and has maintained private practice in Bethesda, Maryland for 20 years. Welcome. Before we get going, Brooke, share with the listeners where you're from originally and where you are currently.
I'm about 2 miles from where I grew up. So I grew up right outside DC in Bethesda, Maryland. And I've, went away for college and grad school and came right back and live really close to where I grew up.
Awesome. So how did all this start for you? How did you get into this field?
So back in 2016, 2017, I was going to tell you how I got into art, but I certainly can go back even further if you want.
I'm really curious as to what pulled you into this field.
Yeah. So, I was in therapy kind of a little bit when I was 9 and then again when I was 12. So I've always grown up with, just no stigma in my family about mental health. So I think that really is kind of the basis for why I always felt it would be okay to go into this field. I majored in Afro-American studies at the University of Pennsylvania, and I was really interested in kind of bigger public policy, social change on a really big scale. And then I realized that as many of us know, is an uphill battle. And I really thought to myself, I want to impact people. And so I really decided that I kind of wanted to do, one-on-one and group work. And so I decided to get my MSW from Columbia, and the rest is history. I did some domestic violence work for 2 years after I graduated, and then moved into private practice, which I've been doing for 20 years.
Interesting to hear you say that, you grew up in an environment where there wasn't really stigma around mental health. 9 years old sounds early. I mean, what was going on at 9, if I can ask you that?
Sure, of course. So my parents divorced when I was 6, and I actually handled it pretty darn well. And then a few years later, I was an anxious kid. I was a nail biter. I was one of those kids who had, stomach aches before every soccer game and test. And, I think they kind of knew I needed some extra help, and it was a really positive experience for me. And so then I was more willing to go back at different times in my life where I needed extra support.
And you mentioned later on that you kind of shifted or pivoted into working with individuals, but why in that context?
I love to feel, and I love connection. And I wasn't feeling that at sort of a public policy kind of level. I did some, lobbied Congress for low income housing. And I, of course, believe in all of that. But I didn't feel that I wasn't moved. And I want to feel in my life, and I like to feel the range of all of my feelings. And I certainly working with someone one-on-one really allows you to see their range of feelings and to access your own. And I believe that's a gift a lot of therapists have, is that we use ourselves to deeply understand other people. And so I have felt more kind of satisfied and fed through this work.
It's interesting to hear you say that. I think that's why I smiled, because I haven't heard many people say that. I love to feel. And especially when we're talking about this work, I mean, you're going to feel. And sometimes you've got to be careful about letting it show. And a lot of times it's not the best feelings that come,
Oh, sure. I mean, I'm not saying I'm some amazing human being who has mastered how to tolerate discomfort and pain. But I always think, when you can feel the depth of that, you can feel the depth of joy. And I just don't think we can do one without the other. I just don't think that's the way life works or the way we operate. You don't know joy unless you know pain, and vice versa.
Yeah. So how did you move into this profession? How did things unfold for you? How was it working with DV?
Yeah, domestic violence work is really challenging. And I do think there's, quite a burnout. So I applaud anyone who can go into that type of trauma work and stay there and do it, for their whole careers. That didn't quite work with me. I loved my experience there. I learned a lot. That's how I really learned how to work with trauma. But after about 2 years, decided that I wanted to see sort of a breadth of issues, not just that one issue. But I certainly think one of the main things it taught me is really about intergenerational trauma, and to hear histories of how, many of these women, it's mostly who we worked with, many of these women experienced domestic violence in their homes growing up, and often could even go back another generation. And so I've been really interested in breaking the cycle and empowering people that they can change their lives so that they don't pass it along to their children.
What was it like for you in a feeling way to be sitting with that as you started? Because that's intense. No two ways about it.
Yep. Very intense work. I think in the beginning I was a little shell shocked, just like anyone coming out of grad school, and a little shell shocked with the sort of depth of pain, the re-traumatization, right? Not just intergenerational, but the women that we worked with, this was not their first, rodeo with trauma, right? I mean, obviously, I don't know exactly the percentage, but a high percentage of women had already been victims of sexual abuse, physical abuse, emotional abuse by parents, caregivers, teachers, and had already kind of developed patterns of interpersonal relationships in which they were also victimized. And I think the hardest part, I want to be honest, it's not a very sort of optimistic thing to say, but one of the hardest things was empowering people, seeing them grow, and then seeing them go back to their abuser. And one thing stands out to me so much is I had worked with a woman. We had a great connection. It really felt like she was feeling more empowered and recognizing the cycle of violence and the honeymoon period and all of that. And 2 weeks later, she came in and she'd been beaten so badly that she'd lost eyesight in one of her eyes. And that's hard. Right. That's hard to watch and know that you tried your best and that, it wasn't landing with this woman and she was not able to metabolize what she was learning yet.
Hmm. Well, is that, correct me if I'm wrong here, isn't that like a common, an understanding of even addiction, right? Or domestic violence? It's a
Relapse.
relapse.
Yep, absolutely. The average woman leaves 7 times before she leaves for good. So you're absolutely right. And I needed to get used to that, right? And to begin to accept that and not take it personally or not feel like a total failure. We cannot help everyone. We do not help everyone. And sometimes we're not the right therapist for everyone. And I think that's important, and also important to share if you believe that. If you're working with someone and you begin to feel that this isn't a great fit, then I think it's our obligation to also share that with someone and talk it over. Do they feel that way? Does the patient feel that way? Or are they really feeling connected? And then why am I not feeling connected? Or why am I not feeling useful and like I'm really being a helper?
Well put. So when you started initially, when you went to UFP, you had what ideas of really helping the world out, making a dent, and then you shifted. Talk to us about your idea of help, creating change. What did that mean to you?
Yeah, well, again, I think I'll be honest, it caused me to be depressed in college when I was trying to work with sort of race relations on campus. And I got depressed. It wasn't it didn't make me happy because it was such an uphill battle. And so then you're right, I did kind of rethink this idea of helping, and, each one teach one, each one reach one. That became more of my motto. And so I found that literally I was happier doing it one-on-one and on a smaller basis, because I really do believe that empathy is what is lacking. I really, truly believe that if everyone could see the commonalities, right? So yes, I don't know what your life is like, that you are, living in poverty and are, maybe a single parent. I may not know that, but I do know feeling overwhelmed. I do know feeling incompetent. I do know what it's like to feel all alone in something. And if I can tap that within myself, I'm much more likely to be able to reach that person. And I really, again, I'm trained in Brene Brown's work. I use it all the time. And her differentiation between empathy and sympathy, I think it would change the world if people could truly understand what empathy actually means and what it looks like in practice, in real life, right? What's a demonstration of empathy? Empathy is not just a feeling. It's how we show up in total presence, acceptance, and with curiosity, not judgment.
I love the extended finger here. So, well, that's a great segue. How did you get interested in Brene Brown's work?
I was like everybody else. I just saw this amazing TED Talk and thought, oh my God, yes, 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 and honestly, Brene is such a straight shooter. And as you can probably already tell, so am I. And so I just related, and she put things into words that I have felt inside, but I couldn't articulate. I just couldn't do it. And so I saw her TED Talk. There was one clinician trained in the DC area in, what was called then the Daring Way. And I immediately signed up. I've been trained since 2013. I was I think I was the third or fourth person in the entire, DC, Virginia, and Maryland area to be trained in the Daring Way. And I think now there are about 36 practitioners in the DMV. And I've led over 20 intensive, group weekends where I basically use this shame resilience curriculum called Daring Greatly to help women figure out why they are not showing up, being seen, and living brave in their lives, and what's getting in the way of that. And shame and perfectionism are at the root of that. And especially in the DC area, people are quite educated here. They are, there's a lot of elitism in this area, and the perfectionism is off the chain, and it is harming all of us.
Okay. So this is great here. All right, let's just pause here for a second to thank our sponsors. All right, we are back. So let's take a couple steps back and summarize, if you will, what the curriculum is, the Daring Way is, because I think many people might know that Brene Brown is associated with the word shame. She kind of highlighted that, but give us a summary of what the work is, the curriculum is. Yeah.
So the curriculum, is a shame resilience curriculum, but the topics we explore, the format is basically we watch videos of Brene teaching us, something, a topic, and then we have a beautiful workbook that we concretize and personalize the lesson that we've learned by writing and exploring. And then we do kind of open sharing, which is where the shame just disappears when you're sharing things. But the topics we explore are shame, vulnerability, trust, perfectionism, empathy, self-compassion. And we learn how all of those are related and what we are willing to give up in the face of trying to be more vulnerable and authentic. And so, we look at what are the messages we got about being vulnerable? What does vulnerability mean to you? And we learn quickly, and then we practice it in the entire weekend. So we're learning about vulnerability, and then we're putting it into practice live. And some people say, I could never share things that are vulnerable with a group of strangers. And I'll say, you'd be surprised. In fact, sometimes it's just easier to do that than with the people we love. And so we're practicing, we're learning that when we share our most vulnerable, shame-filled truth, people don't walk away, they lean in. And so one of the things Brene talks about so much is that vulnerability is the first thing we look for in other people, and it's the last thing we're willing to show in ourselves.
Okay, stop. This is so good. I want to slow down a little bit. Is this just for women?
So I'll be honest. I do not do co-ed Daring Greatlies. I do, and I've polled all the women I've worked with, again, 20 weekends since 2014. And people really do agree that they would not feel comfortable doing it in sort of a mixed gender. And again, these are people who identify as women. So we have, non-binary and trans people participate as well. I've done 19 weekends for women and one for men. Okay. That weekend with men was absolutely magical, and they did the most brave work. But I do find it's a little bit harder to sell to men, to say, hey, want to go talk about shame for 2.5 days and vulnerability? But they need it even more. Men need it even more.
So why, first of all, define shame, and then why does shame fit so prominently in this work, and maybe even in her work?
So, shame to me is the inherent belief that you are not good enough, and that you are actually quite flawed. Shame is something is wrong with me. Guilt is I did something wrong. So guilt, and it's important to know these distinctions. If we didn't have guilt, I don't know what we'd all do, right? You want a little bit of guilt or to make you not do, bad things to other people, or, but shame is I am worthless. Something is wrong with me, and it's person-centered. So we always want to kind of it's not that one is necessarily better than the other, but they do, guilt does not produce addiction, domestic violence,
Right.
all sorts of problems. And shame does. Shame is deeply correlated with, early pregnancy, addiction, and, dropping out of school, all sorts of things. Guilt is not. It's actually sort of inversely correlated with those things.
So the work here is looking at shame, looking at its origins, how it's impacting us. And you also mentioned a couple other words that I love. Vulnerability is one of those.
Yeah.
How do you define that?
So one of the great exercises we do is, we there's all these sentence stems, and it'll say, and again, we write them down, vulnerability is, vulnerability feels like. If vulnerability were a color, it would be what? If it had a texture. And I love seeing what people come up with, because they can be very different. What would it smell like? What would it taste like? All sorts of things. But vulnerability is about risk, and taking risk and opening your heart and not knowing what will happen. And I know one of your favorite questions is, what's your favorite quote? And one of my favorite quotes is, life begins at the end of your comfort zone, right? Nothing magical happens when you're in this kind of comfort, I got this, I know this, I'm safe. It happens when you walk outside of that. And I'm a big fan of likening, I love, metaphors and similes. Therapy to me is like going to the gym. If you do the same exact thing over and over again and expect a different result, it's not going to happen. Right. So the only way we improve at the gym is by experiencing some discomfort. Now, we don't actually do well if we go to a trainer and it's this, aggressive workout, and then we're so sore that we never go back. Right. So I'm not asking you to jump off a cliff when you're sitting with me. I'm there to support you, but I am going to gently push you just a little bit outside, help you learn how to tolerate that discomfort, do it anyway. And that's where the growth, the learning, the getting stronger really happens.
I agree with that, but I want to kind of go back on really what is vulnerability? I mean, you talked about how to get there. Is vulnerability the openness, our sharing of who we are?
Yeah, well, vulnerability is risk and emotional exposure with no guarantees. And so, yes, to me, I like to do kind of motions to reflect, so I guess nobody could see, but to me, vulnerability is literally like opening your heart. It's a heart opening and saying, this is actually who I am. You can see, my degrees, you can see my job title, you can see the way, I show up with, my perfect outfit for the perfect occasion and, and the Botox and the photoshopping and all of that. That's not vulnerable at all. Those are masks. And so one of the things we do at the end of Daring Greatly is to really say, what shields, are you willing to take off? And what do you need to leave on? So we do a creative project in Daring Greatly where everyone goes home and basically puts shame into their shame into a creative project. And my absolute favorite was a patient that I'd worked with for a number of years. And she'd had more plastic surgery than lots of people, let's just say. And she was a beautiful woman, but she had really, so much of it was how she looked. And so she came in and she took every concealer she owned. She like attached it to a black vest, and she came in and she said, I am done with concealer. I am done with the masks. And she, took it all out and threw it in the trash can.
Wow.
So that's what she was willing to do. But she also was identifying that right now she needed to keep a few things. Like, for instance, I know some of my armor is self-deprecating humor. I'm going to poke fun at myself before you can, right? That's a defense. That's a shield, armor that I put on. But you know what? I kind of like that part. So I'm not really willing to give that up. But you know what? I'm willing to give up, feeling like I have to wear makeup to go to the grocery store. I actually don't feel that way, but I'm giving you an example. What am I willing to give up? The perfectionism of, making it look like my kids are perfect. My kids aren't perfect. I'm imperfect. They're imperfect. And I'm okay talking about that. Right. I really don't believe that people want a therapist who shows up as perfect. And I often ask people, think about that one perfect person from high school that you just thought was just on this pedestal. And think about how alone they probably felt because they had to be perfect all the time. And I've talked to the woman from high school that I admire and thought was perfect. She wasn't really happy. She had just put so much, and she, had an eating disorder and she had alcoholism in her family. So it's not that it's to say, you aren't perfect. It's to say we all struggle. We all struggle. And yes, to different extents and about different things. But that's common humanity. And that is, again, how we relate to other people. You don't have to know someone's exact experience to be empathic. You have to tap that same emotion in you and then relate that. That is what empathy is. And empathy isn't about saying the right thing or solving it. Most of these problems that people are coming in with, I can't solve for them. They're much more complicated, but I can sit with them and I can have eye contact and I can show them, by touching my chest or letting out a sigh that I deeply am receiving them, what they're saying, and I'm with them. I'm right there and I'm not going anywhere because I don't want to give the impression that what they're saying to me or a friend is overwhelming. I'm just here and I can't do anything about it, but thank you for sharing me. I believe what I do is sacred and an honor to see people's true vulnerability and authenticity, a true honor and a gift.
Wow, you're very intense. I mean, in the best way. I'm thinking to myself, my God, this is exactly what I want this podcast to be about. I mean, getting to that point. The people who come to you or the people who come to these, seminars, these weekends, whatever?
Weekends, yeah.
Why are they coming?
I would say a lot of people feel stuck, and it's a great place to go do a deep dive of 2.5 days. There are limitations to 45-minute weekly psychotherapy, right? And so going in, getting vulnerable on the Friday night, and, I always say tears are welcome early and often, and somebody gets the award for going first, for modeling vulnerability. And guess what? Sometimes it's me, because I read a poem at the beginning of Daring Greatly and it touches me deeply. And occasionally, I'll be a little teary. It doesn't last very long, but occasionally I'll do it. And then, so it's really women who feel stuck. It's a lot of women who say, there is something I don't know, but something is missing. I can't feel joy, or, I'm with my family and I can't be present. It's women, again, who have it all going on. They can point to the car and the house and the job and the 2.2 children. I think it's more than that now, the average, but something is lacking and they can't put their finger on it. And mostly it's because they're not being brave. They're not trying new things because they are addicted to being perfect and being looked at as perfect and feeling perfect on the inside. And there's no meaning there. It's meaningless.
And not willing to be vulnerable or show that imperfection, right?
Yeah, because it's terrifying.
Right.
People don't walk around like me saying, here, let me tell you what's wrong with me, or what I'm struggling with. People don't. I don't know why I do. In many ways, it doesn't always work out. I fall flat on my face. But you have to be willing to fall flat on your face sometimes, because through that is where you feel most alive. I will tell you that when I am most vulnerable, it may not go well. I may get rejected, but often beautiful things happen. But I have a deeply felt sense of being alive. And I always tell people anxiety and excitement show up very similarly in the body. So you can keep calling it anxiety, or you could start calling it, maybe there's a little bit of excitement in there. And then, it's like a roller coaster. You kind of want to throw up and you're super excited, right?
Right.
So I think the best things in life happen in that space.
Yeah, it's crazy too, because our culture certainly pushes up against allowing ourselves to be vulnerable, being willing to show our imperfections. I mean, at every turn, right? I mean, I don't look at Instagram because of that, because everything is so perfect.
Yep. Yeah, it's very triggering. It's very triggering for people, and they immediately go into shame and comparison, and I mean, I tell my kids this all the time, comparison is the thief of joy, 100%. And it's, I say, keep your eyes on your own paper, stay in your lane, really just think about, how does this feel to me? The second you look over there at somebody else's work, you're either going to feel better than or less than. And I don't think there's much in there in either of those places for us.
As we kind of wind down here, what you're talking about to me is really exciting, because it's creating a space where people can be themselves. People can understand that it's okay to be themselves. What do you feel, Brooke, you bring to this that allows you to do this work?
Authenticity. I mean, I really believe that's kind of, a little bit of the gift I have, and the willingness to model the vulnerability. I've done this 20 times, and each time I sort of do some of the exercises myself. And then very sparingly, I might share something. If people are struggling to go deeper, I might, share a little something about an exercise that everyone else is doing. So I kind of do the curriculum along with them. I know it's sort of backwards and forwards now. And I'm choosing, the thing about Brené's work is you can do the curriculum over and over again, because at the beginning of the weekend, you identify an area of your life you want to focus on. So she calls it an arena. So it could be, your marriage, parenting, your career. It can be any of those things. And then you can just do the entire curriculum again by just choosing a different arena. So it's always a little bit fresh for me, because I'm like, what arena am I struggling with the most right now? And I don't do everything and I don't share everything, but they feel like I'm in it with them. And we do this wonderful sharing at the end where I have each member give feedback to every other member. And I have them press record on their voice memo on their phone. Because what's the hardest thing? The hardest thing is hearing good things about yourself and people are so uncomfortable and there's not a dry eye in the house. And I know they can't be fully present for it. And so I have them record it so they can listen again.
That's
and guess
cool.
what? When I'm having a week where I'm not feeling like a great therapist, I will also listen to their feedback for me. It's not always 100% positive, but a lot of it is. And what most people say is, thank you for being vulnerable yourself, because then we had the courage to do it. And I really encourage more therapists to do that. I don't want to be a blank slate. I don't want to see someone as so much better than me who's a therapist. I want them to have the wisdom and the good boundaries and not to overshare, of course, but to model that they make mistakes too. And I really believe that's a gift.
That's awesome. All right, Brooke, man, where do people get in contact with you?
So certainly my website, which is just my full name, brookebralove.com. And then Instagram is at Brooke Bralove Psychotherapy. I'm also on TikTok and Facebook. And come join me in a Daring Greatly weekend.
So, and people can, I'll have those linked up here at the show notes page at the traumatherapistpodcast.com. Brooke, awesome. Man, love to have you back. You're so inspiring.
We didn't even get to what I thought we were talking about today. So
well, I'll have you back.
Yeah. Thank you so much, Guy. Thank you.
All right. Take care.